Welcome to Week 2 lectures. We're going to start with Chapter 11. Chapter 11 covers vitamins, minerals, and herbs. You're going to find this chapter is pretty straightforward and goes over the same thing again and again. What is the vitamin used for? Why situations you might see it used in, what happens if there's a deficiency in a person with that particular vitamin, and as well as what happens if there's an overdose. So first, let's talk about how vitamins are dosed to begin with. The daily requirements are set forth in a few different ways. First being the U.S. recommended dietary allowance. So that is the amount that is necessary for the maintenance of good nutrition in the average healthy adult under normal living conditions in the United States. The FDA uses RDAs to develop daily values to help consumers compare the nutrients of content of products. This is really the most common thing that people will use to dose vitamins. You don't often see them dosed off of many other things, such as adequate intake, tolerable upper intake level, or dietary reference intakes. So, adequate intake, which is based on observed or experimentally determined estimates of nutrient intake by healthy people, and used when data to calculate an RDA are insufficient. Tolerable upper intake level is the highest level of daily consumption that current data have shown to cause no side effects when used indefinitely without medical supervision. And the last one is dietary reference intake. It's a system of nutrition recommendations from the Institute of Medicine composed of RDAs, AIs, and ULs listed here. So, why might somebody be deficient in a vitamin or multiple vitamins? They could have an inadequate diet. Maybe they're anorexic or have severe weight loss or other situations such as illness, alcoholism, poor eating habits. They could have malabsorption syndrome, such as chronic gastrointestinal disorders, or surgery that results in chronic diarrhea. They might have an increased need for certain nutrients, such as with pregnancy and lactation. If they are young, such as infants, they will have an increased need for nutrients. The elderly, and increased physical activity, and postmenopausal women, specifically postmenopausal women, need more calcium and vitamin D. They could have a deficiency due to medication interactions. For example, some diuretics cause potassium levels to be depleted. So that's just a look at why somebody might have a need for vitamins. So medical supervision is always a good idea. You know, that your doctor should know about the vitamins that you are taking. And if you are the nurse or the medical assistant, we should be asking patients about the vitamins that they're taking. You might wonder why some vitamins are able to accumulate in the body. Fat-soluble vitamins settle into cells within the body and stay there for a long period of time. The fat-soluble vitamins include A, D, E, and K. And if you keep taking them over and over again and your body isn't clearing them fast enough, or if you're overdosing on them, eventually they can accumulate and cause problems. So let's start with vitamin A, which is one of the fat-soluble vitamins. Vitamin A is necessary to for resistance to infection. Most commonly, it's good for night vision, as well as normal growth and development of bones, soft tissues, and maintenance of healthy skin and mucous membranes. It's good for healing of wounds, as well as reproduction. Deficiencies can come from malabsorption of fats, diarrhea, obstruction of bile, presence of mineral oil in the intestines, overcooking of vegetables in an open container, as well as prolonged infection or fever. So signs of deficiency, most obvious one being night blindness, since it's good for night vision, as well as slow growth, anorexia, weight loss, bone and teeth deformities, dry eyes and skin, as well as itching. So, symptoms of an overdose, and this is where we really want to keep an eye because vitamin A overdose can happen very commonly. Recommended amount that somebody is supposed to have per day is, let's see, overdose would probably be greater than 50,000 units or 1,500 micrograms of retinol in adults and just 20,000 units in children. The recommended amount per day is 800 to 1,000 units. I'm just going to stick with the RDAs since those are so commonly used. So overdose, what does it look like? Irritability, psychiatric symptoms, fatigue, lethargy, headache, insomnia, anorexia, nausea, diarrhea, jaundice, joint pain, and myalgia. So why are we concerned about that? Because again, vitamin A is a fat-soluble vitamin. Sorry, somebody wants to come up and visit. Vitamin A is a fat-soluble vitamin, and it can stick around. It doesn't get cleared as quickly as a water-soluble vitamin, which usually gets peed right out after they're taken. What's needed is used up. What's not needed is sent right through the kidneys. So as you can see, if you follow along in the rest of the chapter, it pretty much goes through the signs of deficiency, how much they should get, symptoms of toxicity, and what I really want you to focus on are those areas. Not necessarily memorizing, but picking some of the more important things out. I'm not going to go through every single one of them because essentially what I'd be doing is reading right off the page because I don't have these memorized. I will tell you though that vitamin K is not necessarily something we take too much as far as a supplement. It is used quite frequently for warfarin reversal. So the body doesn't necessarily store it. It's not as significantly stored as the other fat-soluble vitamins. It is found in leafy green vegetables, cabbage, oils, cheese, eggs, and liver. So when a patient is on a drug called warfarin, which thins out their blood, we recommend that they keep their intake of these items constant, not too little, not too much, just about the same amount. Otherwise, if they eat too much of those particular foods, their blood can become, the warfarin might not work as well. So, we are going to, I'm going to let you guys read through the rest of the chapter, again, focusing on those areas that we talked about, and just trying to keep in mind maybe a couple facts for each vitamin. Okay, flip through the rest of the book. Potassium is another one I wanted to cover. Potassium has a lot of a great effect on the heart. If potassium's too low or too high, it really affects the heart, causing arrhythmias and other problems. So potassium's not as commonly sold over the counter as, say, some of the other vitamins. So when somebody's on potassium, they're usually on it because they're on a diuretic that's causing loss, or maybe they have diarrhea or vomiting. So when you see potassium supplementation, you always want to keep an eye on the potassium level and make sure it's within the correct range. Let's see. That pretty much covers chapter 11. And I don't want to read off the page to you guys for the next 10 minutes, 15 minutes, however long it would take. I want you guys to look through it, understand what vitamins are all about, and why we're concerned with deficiencies as well as overdose, especially in the fat-soluble vitamins. And if you have any questions, feel free to contact me. We'll be moving on to chapter 13 in the next lecture.